And more now on the dead baby situation, which unfolded last year. Health Minister Dr. Christopher Tufton is warning that some services offered at the Victoria Jubilee Hospital could be negatively impacted as they work to ensure the bacterial infection doesn't claim any more lives in the nursery at the facility.
We have made some adjustments to the staff complement towards achieving the WHO standard of 1 nurse to 1 to 2 babies. Now, you may ask if we are magicians, because when we had the problem, we said a big part of the challenge was not having the staff. Well, we have attempted to make adjustments where we can, moving around people from one place to the next. It, in some instances, may mean even depriving other parts of the institution with the ideal numbers, because there is a genuine staff shortage for all sorts of reasons. We won't go into that now unless you ask. But the intention is to recognize the vulnerabilities of these neonates, this facility. Many of them compromised because they're in a highly sensitive area.
The health minister, in the meantime, says he has begun meeting with his leadership team to start the process of improving infection prevention practices at the country's medical facilities.
This morning, as said earlier, we convened the meeting with the regional health authorities, the chief medical officers, senior medical officers, to review in this workshop and hopefully to draw some conclusions, comparing both reports and setting some standards or objectives as we move to improve the process going forward. So there'll be quarterly assessment by infection prevention and control teams in the regional health department and also at the ministry's head office.